you just elaborate on the word you said just now, the acronym? Uh,
I didn't say the REBT,
yes.
rational emotive behavior therapy. Okay, let me tell you. See, since I realized that in my whole practice over last 9 years in Mumbai, whenever I was talking to IC patients specifically, there was so much of psychological stress which had become a psychosomatic issue now. And that's where I realized that the psyche has to be dissociated from the real medical issues. And which technique and how do I do that? And that's why I went ahead and trained myself in all possible, counseling techniques. Now, one technique or one therapy part is called rational emotive behavior therapy, REBT, also known at some parts as CBT, cognitive behavior therapy. There you can say the similar names with the same kind of techniques. So a therapist who is trained in these techniques, now I trained myself so I know the technical part of it, is rationalizing the emotions. And rationalizing does not mean ridiculizing an emotion, whether it is of pain, sadness, sorrow, guilt, feeling of not good enough. Yes, they are true. But rationalizing that even with this bad situation, I can do a lot of things. So accepting the pain, giving it that much leverage that you are significant in my life. This pain is significant in my life. It is affecting my everyday. But I am not this pain. I am not my pain. This pain cannot define me. So, giving a projection, zooming the person or patient out from this miserable situation where they have defined their entire life with presence of this pain, fear of this pain, and they have pushed apart intimacy, they have pushed away everything. This how we use rational emotive behavior therapy in IC is what I do. So the technique is called REBT. No, it doesn't come across like full blown REBT कि आप बैठ के सबको A plus B C D जो proper तरीका है एक REBT का वो करो. I do it in a very kind of subtle form. When I see a patient is now in a receptive mode, has come to the acceptance of diagnosis, has understood flares होंगे, इट्स अ प्रोसेस कि मैं खुद समझूंगी मैंने आज पानी कम पिया कि ज्यादा पिया, आज मैं खुद समझूंगी कि आज मैंने क्या खाने में एलिमेंट्स गड़बड़ हुए, आज मैं मेंटली स्ट्रेस थी, मुझे पता है फ्लेयर होगा, बट होगा तो मुझे ये करना है, मुझे एक फ्लेवोस्पास लेना है पहले, मुझे एक क्रोसिन लेना है पहले, नहीं तो मुझे एक सिराशोपेप्टिडेस लेना है, काइमोरल लेना है. सो आई एम्पावर देम विद द मेडिकल फील्ड फर्स्ट and I slowly pull them out where they see I am not my pain. I can still be functional. लोगों को बुखार आता है वो गोली खा के काम करते हैं ना, तो मैं भी कर सकती हूँ. So it's a slow process where rationalizing and accepting these emotions, validating them कि आप बिल्कुल ठीक बोल रहे हो, this is a very bad condition. This is a miserable condition which has screwed up your life totally. I know it. And I validate it कि हाँ ये है तो है, अब क्या करेंगे ना आगे, कुछ तो करेंगे ना आगे, जो आएगा नया नया मैं भी रिसर्च करूंगी, आप भी देखते रहो, जो आएगा हम साथ में हैंडल करेंगे. We are together in this, and that one thing that I am not alone in this, trust me Palka, works wonders. Wonders, it really
It
helps,
works.
and
It
that's what is
works because
REBT.
that is very important. So
Yeah.
now that we were talking about sexual dysfunction, so what suggestion would you give to patients who want to start a family? Because many are scared that IC is related to infertility, IC can cause miscarriages, stillbirths, whatever. So there is this hesitation. So
See, I'll say that talk to your doctor, talk. Bring out these inhibitions, because I say that fertility is not dependent on a bladder. Fertility is dependent on your hormones. If your hormones are in your sync, if your mind is straight, and it's all hypothalamus, thalamus, and your brain and your pituitary. So अगर आपके emotions sync में है, trust me, fertility will not be an issue. But how will you keep those hormones, the axis of your pituitary, your ovaries, your adrenals, and your uterus in sync, unless you are not in a right frame of mind that I want it? I want fertility. I want to have a child. Now, what do I do about it? Now, again, rationalization comes in the picture. ये मेरा condition है, ये IC है. Now, since IC is an inflammatory condition, do you know many times pregnancy hormones can suppress that inflammation also because of high progesterone? सो आई नॉट लुक एट अ गुड पाथ? अगर आपके पीरियड्स ओके हैं, रेगुलर हैं, टाइम पे हो रहे हैं, हेल्दी हो आप इन जनरल, बाकी सारी चीजों में सब कंट्रोल में है, व्हाई नॉट ट्राई इट, गो अहेड। आपकी एज अभी गुड जोन में है, आप इतने ज्यादा आगे नहीं निकल गए हो जहां एग्स की क्वालिटी या एजिंग हो चुकी है एंड जेनेटिक इश्यूज इन बेबी आ सकते हैं। सो किस चीज से डर लगता है ये बताइए ना मुझे,
Yeah,
पेन
but
से डर
um,
लगता है?
what happens,
हम्म,
many of the IC patients, they also have vulvodynia, they also have
या
endometriosis, so
या
fibromyalgia, and all this,
श्योर,
combined together, that really make them very skeptical about not only starting the family, but also, raising the kid. These are,
true, these are real things. See, the thing is, I won't give blind hopes कि नहीं please आप जाके करो. Again, that's what is REBT all about, that you sit down, write down all your concerns, see what are the risks, what are the benefits. And yes, I agree that you deeply want to have a child. There is a deep inherent desire to nurture a child, to bear a baby, to rear a baby, and that maternal instinct is really killing you कि मुझे क्यों नहीं मिल सकता. I do understand that. So again, validate कि आप बिल्कुल ठीक बोल रहे हो, आई डू अंडरस्टैंड, बट एट द सेम टाइम लेट्स ट्राई टू रैशनलाइज कि क्या अपने केस में इंडिविजुअलाइज करके क्या मेरे रिस्क हैं और क्या मेरी कंडीशन है, क्या मेरा मेंटल स्टेट है, क्या मेरे पार्टनर का फाइनेंशियल स्टेटस है, क्या मेरा बैकअप है, क्या मेरा सोशल बैकअप है, मैं अपनी प्रॉब्लम्स में मैं बच्चे को कितना रख पाऊंगी. वी make them right. We do a lot of in session homeworks, in session works, writing these things, these fears, anxieties, and when it comes on paper we help the patient to sort out कि इस पूरे पैकेज के साथ do I still want that? सो कैन आई जस्ट अरेंज अ बैकअप सिस्टम विद मी? है क्या मेरे पास इतने फाइनेंसेस कि मैं 2 आया रख लूंगी साथ में, एक घर पे रख लूंगी, या मेरे इन लॉज या मेरे पेरेंट्स इतने सपोर्टिव हैं, दे विल बी एबल टू मेक श्योर कि बेटा हम हैं तुम्हारे साथ, यू गो अहेड एंड प्लान इट. मेरी बॉडी क्या अलाउ करेगी, क्योंकि एंडोमेट्रियोसिस है, वल्वोडाइनिया, इंटीमेसी तो हो नहीं पा रही है, क्या करें? सो इज इट अ पॉसिबिलिटी कि हम आईयूआई से कर ले, क्योंकि पीरियड्स तो मेरे रेगुलर हैं, सो क्या मैं वो कर सकती हूँ? यस, वी कैन डिस्कस दैट. अगर वो भी नहीं करना है बट आई स्टिल वांट कि यार मुझे एक मेरा बायोलॉजिकल बच्चा चाहिए, कैन वी थिंक ऑफ सरोगेट? medical advancement is available, but we need to use it judiciously, wisely, for rightly indicated cases. Now अगर fear सिर्फ ये है कि मेरे body नहीं ले सकता, but mentally I am strong enough to take care of a child, so this has to be sorted out ना, कि डर आपको इस बात से है कि मेरी बॉडी नहीं ले पाएगी, या डर इस बात से है कि मैं बच्चे को कैसे पालूंगी अगर मेरी खुद की हालत इतनी खराब हो जाती है. Now understand that happy hormones, if you are in a happy zone of life, if a child can really bring that back life to you, trust me, you will be able to manage. Yes, be rational, be practical, ki you will need help in certain days. There will be challenging phases and you will be able to sail through. Do you want to try? So we don't jump in it. डिस्कशंस काउंसलिंग सेशंस टिल द पॉइंट आप पूरे इधर हो जाओ, हाँ मुझे करना है, चलिए हम आपके साथ हैं, आईवीएफ स्पेशलिस्ट से मिलेंगे, बात करेंगे, टीम से बात करेंगे, वी गो इट. नहीं मुझे नहीं करना है, देन ओके, दिस चैप्टर इज क्लोज, वी आर नॉट कमिंग बैक अगेन एंड अगेन, रोज एक दिन खराब नहीं करेंगे इस मेंटल चर्निंग में, लेट्स मूव ऑन विद लाइफ. एक्सेप्टेंस इज इंपॉर्टेंट, बी ऑन वन साइड, ग्रे जोन में भटकते ना रहे, ऐसा मैं बोलती हूँ.
uh, we don't really know the cause of IC, but now that many feel that IC is more of a psychosomatic disorder, so do you think that some kind of trauma or injury or some kind of stress in life and all can actually trigger
Yeah.
IC? Because many have a history, that is not a very happy
Sure.
history, and they have IC.
Yeah. See, definitely. I wish I could figure out one single cause of IC and I could just fix that. I wish I could do that. But नहीं है, sadly नहीं है. I have seen cases जिनको कोई stress नहीं है लाइफ में, और suddenly one fine day a young girl जो सब अच्छा चल रहा था, college going girl, and suddenly started having bladder issues and वो 2 साल लगे फिर उसमें IC निकला, and young girl just married and then suddenly started having UTIs after marriage, and then बाद में पता चल रहा है IC है. There are so varied presentation, but yes, Largely, not all, I'll say 10 to 15% patient have this kind of pattern जिनमें background कोई psychological trigger नहीं है but हो गया है, we don't know why. But most of them, almost 60 to 70% of patients, when they sit down with us and when they look back, there is categorically some traumatic event of life happening somewhere. It's a broken relationship, betrayal in husband wife relation, it's loss of a child, sexual abuse, multiple episodes of sexual abuse or multiple rejected relations, uh, household issues, parental rejection, sort of things. So there are a lot of pented up psychological emotions. Now, how do they eventually become IC? We don't know. We have no answer to it. At least the modern science don't have answer to it. But we see a lot of triggers in flares happening whenever those emotions hit them back. Just like means if a person has felt at some point of time unsafe in long back in childhood maybe, and has never said those emotions, never spoken up, and now a situation arises where suddenly a person feels threatened, एंजाइटी हैपन्स. अब वो हो सकता है इवेंट बड़ा ट्रिवियल हो आज, पहले हुआ कुछ और था जिसमें वो बच्चा घबरा गया था और उस टाइम नहीं कुछ कह पाया, बट आज कोई इवेंट होता है जिससे इमोशन वही आया है फियर का, चाहे वो है कुछ और कुछ भी नहीं है, सिर्फ इमेजिनेशन ही है, बट इमोशन वही फियर का आया. दिस विल ट्रिगर द सेम रिस्पॉन्स एंड कैन फ्लेयर आई सी नाउ. So definitely there is a big connection, and that's why it goes in our sessions, my sessions with patients go in very detailed counseling, where I keep asking them that even in future if you feel you something comes up in your mind, please share with us. And that's why there's a lot of role of even hypnotherapy, and I strongly believe in it.
uh, any like physical injury can also trigger IC, like some back, some injury to the
Yeah, see
back.
again I can exactly spinal cord injuries जैसे हम बोलते हैं कई बार, trauma हो गया है, prolonged hospitalizations, not a direct relation कि एक healthy bladder एक spine की injury से क्यों खराब हो जाएगा, but yes prolonged catheters हैं, repeated UTIs हुए हुए हैं, immobilization है, many times मानिए फ्रैक्चर ऑफ फीमर हो जाता है ओल्ड लेडीज को, अब रात में कोई उठा उठा के यूरिन कराने वाला नहीं है घर पे, और पूरा दिन वो बेड पे पड़े रहते हैं, किसी को तंग भी नहीं करना चाहते हैं, सो दे कीप होल्डिंग ब्लैडर फॉर लॉन्ग 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 आवर्स, होता है. Then there is a time when they want to get up on their own and they are leaking urine before they reach the toilet. So a lot of it's a very slow process where prolonged immobilizations over a period of month may have made them hold urine for long hours, and then because of that now it has become a trigger. Repeated UTI हो के पूरा mucosa इतना inflame हो चुका है कि अब UTI नहीं बचा है but inflammation नहीं जा रही है. That becomes also something like IC. Can happen, but direct physical injury to bladder will not immediately trigger something like a whole inflammation of bladder.
But holding urine for a long time can lead to
Oh,
IC.
yes. Oh, definitely. Because, one thing consistently in young IC patients, I see, they take pride. मतलब एक तो शुरू से एक ब्लैडर ट्रेनिंग की हैबिट हम लोग बच्चों को तो सिखाते हैं, बट टीनेज में आते आते सब भूल जाते हैं. सुबह निकलते हैं मुंबई में लोग कहाँ, विरार से पहुंचते हैं चर्च गेट, बीच में कॉलेज करना है यंग गर्ल्स को, फिर वहाँ वॉशरूम अच्छा नहीं है. सैडली मुंबई लोकल ट्रेन्स डोंट हैव टॉयलेट्स, गुड टॉयलेट्स फॉर वुमेन. 2 घंटा, सुबह 4 बजे निकलती है लेडी विरार से, 6 बजे की ट्रेन पकड़ती है, उसके बाद वो 8 बजे चर्च गेट पहुंचती है, वहां जाके सीधा अपनी जॉब पे बैठ जाती है, पूरे रास्ते 4 आवर्स से यूरिन नहीं किया है, वहां पे लंच टाइम तक शी इज जस्ट सिटिंग. एंड व्हाट हैपेंस दैट ब्लैडर आफ्टर अ सर्टेन टाइम स्टॉप्स गिविंग यू सिग्नल्स, एंड इट्स अंडरस्टैंड दैट बॉडी मेक्स यूरिन 24 आवर्स अ डे. सो सारे वेस्ट प्रोडक्ट्स जो बॉडी में है, यूरिया, अमोनिया, नाइट्राइट्स, दे आर लाइंग इन योर ब्लैडर कंटिन्यूअसली, होल्डिंग ब्लैडर फॉर 6 6 आवर्स, 8 8 आवर्स, एंड पीपल टेल मी वेरी प्राउडली, अरे मैं तो 10 10 घंटे भी नहीं जाती, ये तो अब होने लगा है कि हमें 1 1 घंटे में जाना पड़ा. एंड आई फील इट, ये अब इसलिए हो रहा है क्योंकि आपने इतना इतना यूरिन होल्ड किया है. इन आवर वर्किंग लाइफ, वर्किंग वुमेन, होम मेकर्स, 8 8 घंटे निकल जाते हैं, यूरिन नहीं जाते कि लगा ही नहीं. ऐसा हो सकता है क्या कि 8 घंटे यूरिन बना ही नहीं है, बना है और वो आपके ब्लैडर में पड़ा है. सो मेक श्योर दैट इन 3 to 4 hours please go and empty your bladder even if you don't feel like. That's the best thing which you can teach your young girls, with the best thing which you can do for yourself, ताकि at age of 40-50 मेनोपॉजल के टाइम पे, एज पे, मेनोपॉज में आपका ब्लैडर इन्फ्लेम होना शुरू नहीं हो जाए जब वहां ड्राइनेस बढ़ने लगेगी. And that's one of the most significant preventive measures I insist to every lady, to everyone, every girl also who comes to me for PCOS, endometriosis, कि please अपना bladder हर 4 घंटे में खाली करके आया करो. Don't think कि toilet dirty है. There are multiple ways you can sanitize it. There are multiple ways you can use Indian toilet. Go empty your bladder 4 hourly, even if you are not feeling it. Is the best preventive way of IC.
So really helpful. I wish I had known this during my college life. Because
Nobody told me, Balika.
I used to do the same. My
We as
college,
medical students, we never, I don't even realize कि washroom कहाँ होता था मेरे
yeah,
उसमें,
and
reception hall के
actually I
बाहर.
was one of those who used to take pride in me. I go
हाँ.
to college in the morning and whole day I don't use the
Yes,
washroom.
evening में आके करे. And it is surprisingly that is what fires back,
Yes,
because कहीं ना कहीं वो सारे metabolites ने bladder को ही damage
I
किया है ना.
learned it the hard way.
हाँ.
So the next question is you were talking about menopause. So what can, a menopausal woman do to prevent or to, manage IC? Because the general belief
Yeah.
is that IC becomes more, uh, you know, bad during menopausal years. Is it?
Yeah. See, the thing is, there are many patients in menopausal time, they keep getting repeated UTIs, and it's a part of going through the menopause because the vagina is dry, the urine pipe is shrinking. Many times they are not able to pass urine completely. Simply said, if you want to prevent it, be very watchful. Good bladder habits is drinking around 2 liters water a day and in divided amounts. Never over drink. पूरा दिन पानी नहीं पिया, वापस आते ही गड़ागड़ आपने 1 लीटर पानी पी डाला, अगले आधे घंटे में योर ब्लैडर विल बी फुल विद 800 ml of urine. So don't torture your bladder by suddenly overfilling it and suddenly not drinking for the entire day. The best is that you fix your water intake and keep drinking throughout the day, small amounts, maybe 100 200 ml every hour, and you can finish 2 liters in 12 hours आराम से. मॉर्निंग 8 से 8 में आप खत्म कीजिए. Avoid drinking in the night hours because let your bladder rest. वी हैव अ हैबिट ऑफ एक बड़ा ग्लास दूध पीना है सोने से पहले पानी पीना है, दवाइयां सारी सोने से पहले खानी है विद 2 glasses ऑफ वाटर. एंड समटाइम्स आई फील इज इट रियली नीडेड? आपको जो पानी पीना है आप 8-9 बजे तक पी लो ना, सो दैट रात में आपके ब्लैडर को रेस्ट दो, बिकॉज 8 hours योर ब्लैडर इज गोइंग टू होल्ड द यूरिन एंड योर किडनी इज गोइंग टू मेक यूरिन कंटिन्यूअसली. लेट द ब्लैडर रेस्ट सो दैट आपकी 6 घंटे की नींद में उतना ही यूरिन बने जितनी जरूरत है, और सुबह उठ के आप उसे क्लियर करो. नाउ देयर आर पीपल मॉर्निंग में उठते ही 4 ग्लास पानी पीते हैं क्योंकि उससे पेट साफ होता है. Nothing wrong in it. But what's happening? You are overloading suddenly your kidneys with सीधा 4 glasses. 1 लीटर पानी गया अंदर, अगले 1 घंटे में बनेगा 900 ml. आपका ब्लैडर होल्ड कर सकता है क्या ऑलमोस्ट 1 लीटर यूरिन? एंड देन देर आर पीपल हु विल सडनली गो टू वर्क. अब 900 ml यूरिन अंदर लेके आप बैठे हो. सेम थिंग विच हैपन्स कि वो कहाँ जा रहे हैं सारे मेटाबोलाइज, ब्लैडर को ही डैमेज कर रहे हैं. सो टाइम योर वॉइडिंग, मेक श्योर 4 घंटे में आप यूरिन जाइए, सोने से पहले यूरिन जाइए. अगर आपको लगता है कि आपने रात को बहुत लिए हैं ड्रिंक्स, पार्टी गए थे, वाइन्स ले लिया है कुछ, पुट अप एन अलार्म, रात में 2 बजे उठ के एक बार और एम्प्टी कर लीजिए. सो देयर आर सर्टेन थिंग्स विच वी help them. And reach out to your doctor early when you are going through menopause. Educate yourself. Knowledge is power here, because if you know कि bladder symptoms होते हैं और ignore नहीं करने हैं, you will pick it up early. And early picking means we can delay the progression. Once it is established in a bad state, it becomes very difficult. So, yes, creating awareness, which your forum is doing beautifully, that's one of the biggest steps to prevent it in perimenopausal zone.
So we have more or less come to the end of the discussion. I don't really have any more thing to ask. It was really wonderful talking to you. It was so insightful, so knowledgeable. I'm sure the patients are going to benefit from this session. So, any last words you want to say for our patients?
For IC patients, now my heart goes out to you people. I wish I can do more research. I wish I can bring the best of the world for you to India. I really wish, and I'll work hard. I'll really work hard to figure out what I can do best for you because I know how much you suffer. I have patients who have heart wrenching stories. And being a trained counselor, I try to help them. But then when I actually hear it, it's painful. It really hurts what they suffer through, what they go through. There are limitations to my medical knowledge. I'm trying to add more and more skills that where how do I, make this my at least my services complete where they're taken care of. I try to do my best, but it's not enough. It's not enough. So whatever I can do to support every single patient of IC, they are all my patients are personally connected with me. I feel so much for them. I really feel so much, and I wish there are more platforms like yours, Balkai. We need more people who can create this awareness and create a safe zone and space. Create those support groups where patients can be available for, each other. It is really helpful. It is needed. That's what I want to say. That I will try my best. You just do one thing, that approach us. ओके जिनको नहीं पता नहीं आता माफ कर दो उन्हें उनकी गलती नहीं है बट यू आस्क फॉर इट वी विल बी देयर whosoever जितने भी लोग हैं जो आईसी के फील्ड में काम कर रहे हैं वी ट्राई आवर बेस्ट टू मेक आवरसेल्व्स अवेलेबल टू यू बट साथ में चलेंगे इसमें we have limitations you have I know whatever resources we can provide you we are together in it I am with you whatever way I can be that's what I
It
want to
means a
tell my
lot.
patients
It means a lot to all of us that we have such compassionate doctors to guide us, to help us. So really thankful to you. Thank you very much for this session. So hope
It's
to
my
see you
pleasure.
again
It's all
in this.
all my pleasure, Balika. Thank you very much. Bye.